With spring and summer travel season upon us, nothing ruins a vacation faster than getting sick. Today, we're going to get some timely tips for staying well so you can enjoy that vacation. It is our pleasure to welcome Dr. Carolyn McClain, ER physician and assistant medical director with the urgency room. Welcome. Good to have you here today. Thanks. I'm just coming back from vacation. Had a little cold when I left, but I nursed it and I kept taking vitamin C and I tried to take as good a care as I could on this, but sometimes you have to just give in, right? All right. We're going to talk about some things here. And you say, first off, you should have all your shots. What kind of shots are we talking about?
So if you're traveling internationally, you want to make sure that you have all the immunizations you need. And there's a lot of diseases in other countries that we don't have here, like yellow fever, Japanese encephalitis. So you want to prepare because in order to get those vaccines, sometimes they take several months to kick in. So you want to see your doctor early. And you can also check on the Center for Disease Control. They have a website that tells you exactly what vaccinations you need before you travel.
And for domestic travel, you should, at the very minimum, have a booster shot, though?
Yeah, so your tetanus should be up to date.
Tetanus
and
shot.
That way you don't have to end up in an ER in the middle of the night because you cut yourself.
Pack your prescriptions. So often people forget everything that they take.
Exactly. Yeah. So a lot of times you are, it's the night before, you're packing and you look in your pill bottle and you have 2 left. And you think, I'm going for 7 days. So try to think ahead, make sure you have all the medications you need that you take on a daily basis, like your blood pressure medicines, cholesterol. Make sure you have those, and then pack them in your carry-on, because the last thing you want is to get there and not have your luggage, and not have those.
Which does happen. You like the idea of an emergency kit. What should be inside that kit?
So first of all, if you have medications that you take only occasionally, like your inhaler, if you have asthma, or an EpiPen, let's say you have allergic reactions, my gosh, you better make sure you bring that along. Migraine medicine. But then if you're traveling internationally, some places, they don't have medications like Zantac, stuff that you might take over the counter. And then if you're lucky enough to go someplace south where the mosquitoes are already out, make sure you bring mosquito repellent, because the Caribbean and Mexico have things like dengue fever, which you can get, so it's good to be prepared.
Serious stuff there. Be careful on the plane.
Yeah, so a lot of times you'll see patients come into the urgency room after they've been on a plane and they say, I know where I got this. I was just on a plane.
Coughing,
yeah, they were
sneezing.
Coughing all over the tray table and the seat. So on the plane, there's not a lot you can do other than bring hand sanitizer. But when you get off, you should wash your hands with soap and water, because the norovirus, which is the one that gives you diarrhea and vomiting, that is not susceptible to hand sanitizer. You have to wash your hands to get it off.
And eat carefully. You always say that's so important.
Yeah, so number one, if you're leaving the country, make sure you can drink the water. If you can't drink the water, don't brush your teeth with it. And then make sure any fruits and vegetables you eat are washed with bottled water. And also, if you have diabetes or heart failure and you go on vacation, you're on vacation, so you're eating lots of rich food, lots of salt. Make sure that you think about that, because your health doesn't go on vacation.
It does not. We're going to leave it there this afternoon. Happy travels to you and to everyone watching today. The good information you've given us. More you can find on the topic at kare11.com. Just look under the local section and the news at 4. We'll be